Imagine this. It's a cold winter morning on a dairy farm. You've got the cows inside. Seems safe, right? Away from the snow and wind.
Mm-hmm. Typical setup.
But then, almost overnight, that simple act of housing them indoors turns into this hidden health crisis, sweeps through the whole herd.
It can happen incredibly fast.
We're talking about winter dysentery in dairy cattle. Now, it might not sound, super dramatic initially.
Name's pretty straightforward.
Right, but its impact, especially on the farm's bottom line, that's anything but minor.
Oh, absolutely. The economic hit is significant.
So our mission today is really to cut through all the jargon and the info overload. We want to unpack what makes this disease tick.
From the causes to the real-world effects.
Exactly. The sneaky causes, the unexpected ways it just cripples productivity. Get ready for some hopefully aha moments about what seems like just a bit of diarrhea.
It's much more than that.
Okay, so given that picture, let's dive right in. Fundamentally, what is winter dysentery and why does it hit so hard?
Well, basically, winter dysentery is an acute, meaning sudden and highly contagious gut disorder. It mainly hits adult dairy cows when they're housed inside, usually during the colder months.
Okay, acute, contagious, housed adults, what does it look like?
The most striking feature, like the name says, is this sudden, really profuse, watery diarrhea. But here's the interesting part, the paradox almost. Despite spreading like wildfire, you can see up to 100% of a herd showing signs within a week. Maybe 20–50% in just a few days.
Wow, that's fast.
It is. But the mortality rate, it's consistently really low, usually just 1 or 2%. So lots get sick. Very few actually die from it.
That's such a key point because if you're only looking at deaths, you miss, 98% of the actual problem?
Precisely. It spreads fast, but rarely kills directly.
So for a farmer, if it's not killing animals, why is it still such a massive concern? What's the real cost then?
That's the critical thing to understand. You can kind of think of it like the John's iceberg idea. For every animal that dies, way more are affected underneath the surface.
Right. Even though the diseases themselves are different, one chronic, one acute, the principle applies.
Exactly. Widespread illness, even if it isn't fatal, just profoundly disrupts how the herd functions. Productivity takes a nosedive.
So the focus shifts from just saving individuals to stopping the whole herd getting sick.
Absolutely. Preventing that widespread illness is key because the farm's overall health, its profitability, takes a huge hit. And this isn't some, local issue.
Yeah.
It's global. Reports from the U.S., Canada, U.K., Europe, Australia, New Zealand, Israel. Pretty much everywhere dairy cattle are housed indoors, especially November through April.
Okay, so huge impact, spreads everywhere, even with low mortality. But what's actually causing it? What's the agent behind all this disruption? I heard something about a coronavirus.
You did, yes. The primary culprit, the one most widely accepted, is bovine coronavirus, BCoV for short.
Bovine coronavirus, like the ones we hear about elsewhere.
It's in the same family, yes, but specific to cattle. And what's really interesting about BCoV, makes it a bit of a double threat, is that it's what we call a pneumoenteric virus.
Pneumoenteric. Okay, break that down.
It means it can infect both the respiratory system, lungs, airways, and the intestine, the gut.
Ah, okay. So that explains. You might see coughing too.
Exactly. That's why sometimes you'll see mild respiratory signs like a cough or some nasal discharge, either along with the diarrhea or maybe even before it starts during an outbreak.
A double threat virus. Interesting. So how does this thing actually spread, especially in those, close winter quarters? And how does it manage to stick around and cause problems year after year?
Well, the main ways it spreads are fecal-oral route.
Meaning contaminated feed or water?
Right. Cows ingest it.
Right.
And also through virus particles in respiratory secretions, which obviously becomes a bigger issue in crowded indoor settings.
Makes sense. And sticking around.
That comes down to a really crucial feature of DCoV. It survives best at low temperatures and low UV light. Perfect winter conditions, really.
So it builds up in the environment over winter.
Precisely. That environmental reservoir, plus the fact that you can have healthy-looking cows actually carrying and shedding the virus without showing signs.
Carrier animals, right. Always complicates things.
It does. That combination explains why outbreaks can just keep recurring in the same herd. Sometimes every year, sometimes maybe every 3 to 5 years. It's a pretty sneaky virus that way.
Sneaky indeed. So once it gets in the cow, how does it cause that really severe diarrhea? What's happening inside the gut?
So BCoV specifically targets and replicates inside the cells lining the gut wall, particularly in the lower part of the small intestine and the colon, especially a section called the spiral colon.
Okay, the gut lining
Yeah,
cells.
think of those cells as the ones responsible for absorbing nutrients and water. When decob gets in, it damages and basically destroys them. Degeneration, necrosis is the technical
So
term.
the gut just stops working properly.
Essentially, yes. It leads to what we call malabsorptive and secretory diarrhea. The cow can't absorb nutrients or water properly, and the damaged gut actually leaks fluid into the intestines.
Leaks fluid too.
Yeah. If you could look inside during a bad case, you might see tiny little pinpoint hemorrhages, like bruises, on the gut lining. All this cell destruction means massive fluid and electrolyte loss.
Which leads to dehydration.
Dehydration, metabolic acidosis, low blood sugar, all those systemic effects stem from that initial damage in the gut.
So, okay, let's connect that back to the farmer. What does this all look like on the ground? Beyond just, diarrhea, what are the full range of signs they might see?
Well, you've got the obvious, that acute onset of severe watery diarrhea. It's often foul-smelling, dark green to black, sometimes really explosive. You might even see some blood or mucus in it.
Grim.
It is. But there's also this unique, though subjective, clue. Farmers often report a very distinctive smell in the barn. Yeah, often described as kind of sweet, musty, unpleasant. It's one of those things, apparently, once you smell it, you don't forget it. Some vets even say they can almost diagnose it just by the smell in the air.
That's fascinating. A diagnostic smell. What else?
You can also see more general systemic signs, things like a fever, the cow seems depressed, maybe off her feed, variable anorexia, mild colic, signs of dehydration.
And the respiratory signs you mentioned.
Right, because it's pneumoenteric, you might see some mild coughing or nasal discharge too.
Yeah.
It all fits the picture of B. cov infection.
And then there's the big one, the reason this causes so much economic pain, the milk production.
Ah, yes. That's really the hallmark economic impact. We're talking a profound and very rapid drop in milk yield.
How profound.
Reported losses can range anywhere from 25% right up to, believe it or not, 95% of daily milk yield during an outbreak.
95%. That's basically drying off the cow.
It can be incredibly severe. There was one study that estimated an average loss of about 51 liters. That's around 13.5 gallons per cow over a 26-day period, including the lead up in recovery.
And does it bounce back quickly, or is this a long-term hit?
That's the other critical piece. It's often not a quick bounce back. The herd's milk yield can stay significantly reduced for weeks, even months, after the cows seem to have recovered from the diarrhea.
Weeks or months.
Yeah.
Wow, that's a huge financial drain.
Absolutely. And it's not just volume. The milk composition can change too. They've observed about an 11% increase in free fatty acids, a slight increase in the fat-to-protein ratio. Indicating the cows are in a negative energy balance. They're mobilizing body fat because they're sick and likely not eating enough.
So massive milk loss, potential long recovery, changes in milk quality, any other costs.
Oh, yeah. You've got vet bills, extra labor, dealing with sick animals, weight loss in the cows themselves, and potentially even longer-term impacts on reproduction. It all adds up very, very quickly.
That really paints a picture of why, despite low mortality, this disease is such a dreaded event on a dairy farm.
It really does. That huge hit to milk production isn't just a number. It's weeks, sometimes months, of serious financial strain, which really begs the question, how do you even begin to confirm what you're up against, especially when so many other things can cause diarrhea?
Right, that's a crucial point. This raises an important question. How do you definitively diagnose winter dysentery if other things look similar?
That's often the challenge. A lot of the time, the initial diagnosis relies heavily on that classic pattern we talked about.
The epidemiology and clinical signs.
Exactly. The rapid onset, how quickly it spreads, short duration in one cow but hits many, that massive milk drop, very low death rate, and the fact it's happening in winter when cows are housed. That whole picture just screams winter dysentery.
So pattern recognition is key. But what about lab tests? Can't you just test for B. cov?
You can, but there are limitations. Lab tests for B. cov, things like PCR and feces, can unfortunately have, well, less than perfect sensitivity. You can get false negatives.
Meaning the test says it's not there, even when it is.
Correct. And turnaround times for some tests can be slow. Several days for cultures to rule out bacteria, maybe even longer for things like John's testing.
So you can't always wait for the lab.
Often, no. You need to make management decisions based on the clinical picture right then and there, because the herd's suffering and the milk loss is happening now.
But labs still have a role for confirmation.
Oh, definitely. Despite the limits, tests like fecal PCR or maybe electron microscopy looking for the virus particles, or paired serology checking blood samples taken weeks apart for a big jump in antibodies.
Because many cows might already have some antibodies.
Exactly. Baseline seropositivity is common, so you need to see that fourfold increase to confirm recent infection. These tests are valuable for definitive confirmation, understanding the epidemiology, tracking outbreaks.
And ruling other things out must be critical too. You mentioned salmonella.
Absolutely vital. You have to consider other possibilities.
Yeah.
Bovine viral diarrhea, BVD, coccidiosis, especially enteric salmonellosis, even just major feed upsets.
Why is that differentiation so incredibly important?
Because the treatments and outcomes can be drastically different. Salmonella, for instance, can cause much higher mortality. It often does require antibiotics, and it has public health implications too. Getting that wrong could be disastrous for the herd. You need to know what you're actually fighting.
Okay, so let's say the picture fits, maybe you get lab confirmation later, but you strongly suspect winter dysentery. What's the immediate game plan? How do you manage an outbreak?
Well, the first thing to remember is that winter dysentery is generally self-limiting. Most cows will recover on their own.
So you're not really curing the virus itself.
Not directly, no. The main focus, the cornerstone of management, is supportive care. It's all about easing the symptoms, preventing complications like severe dehydration, and helping the cow's body fight off the infection.
Right. Supportive care, number one is probably fluids, given the diarrhea.
Absolutely critical. Fluid and electrolyte therapy is paramount. For milder cases, just providing oral electrolytes in the water might be enough. But for cows that are really down, severely dehydrated.
5E fluids.
Yes, intravenous fluids are often necessary. Things like lactated ringer solution. In really severe, almost comatose animals, sometimes even hypertonic saline is used for rapid resuscitation, followed by other fluids. The key is tailoring it, replacing lost fluids, and correcting those electrolyte imbalances, like sodium loss with diarrhea.
Okay, rehydration first. What about getting them eating again and managing discomfort?
Good point. Nutritional management is also vital. You want to keep them eating if possible, or encourage them to start again. That means constant access to fresh, clean water, offering really palatable feed, maybe free choice salt, and actually increasing effective fiber like adding some good quality grass hay or even wheat straw can help support gut function.
Interesting, adding fiber. What about medications? Pain relief, inflammation?
Yeah, anti-inflammatories, NSAIDs like Flunix and Miglamin can be used. They help with fever, inflammation, make the cow feel a bit better. But, and this is a huge but, NSAIDs are absolutely contraindicated, meaning you should not use them in dehydrated animals unless you can guarantee you can rehydrate them very quickly.
Why is that?
Because NSAIDs can be really tough on the kidneys, especially when blood flow is already reduced due to dehydration. You risk causing kidney failure, nephrotoxicity. So hydration always comes first before reaching for the NSAIDs.
Got it. Hydrate first. What about antibiotics? Seems like a gut infection.
That's a common thought, but remember, this is primarily viral. So antibiotics are generally not indicated. We really discourage routine use because of concerns about antimicrobial resistance.
Makes sense. When might they be used?
Really only if you strongly suspect or have confirmed a secondary bacterial infection complicating things, or maybe in those really severe hemorrhagic cases where there's a risk of bacteria crossing the damaged gut wall into the bloodstream. But it should be targeted, not routine.
Okay. Are there any newer approaches? Things beyond fluids and basic nutrition?
There are some emerging supportive therapies people are looking at. Things like products designed to bind potential toxins in the gut, or direct-fed microbial probiotics, essentially aimed at supporting the beneficial gut bacteria or maybe interfering with how the virus binds, trying to boost gut health and immune function from that angle.
Interesting. So supportive care is key during an outbreak, but really the goal is to avoid it altogether, right?
Absolutely. While supportive care is essential once it hits, prevention and solid biosecurity, that's the real cornerstone for managing winter dysentery long-term.
You mentioned some pretty strict biosecurity measures, earlier closed herds, long isolations. For a lot of farms, that might feel, well, almost impossible in practice. What are the most practical, high-impact steps a farmer can take if they can't achieve that perfect ideal?
That's a fair point. It's about layers of protection, doing what's feasible and has the biggest impact. A completely closed herd is the gold standard, sure, but often not practical.
So what is practical?
Strict protocols for any new animals coming in. Isolation for at least 2 to 4 weeks, ideally 30 days, and critically, in a completely separate facility. Different airspace, no shared equipment or personnel going back and forth without changing gear.
Okay, isolation is key. What about visitors, feed trucks, etc.?
Rigorous visitor control. Clean coveralls, boot disinfection, though we have to admit standard boot baths alone have limitations. It's about managing all entry points. And then manure management, that's huge for Beak OV.
Because it's shed in feces and survives in the cold.
Exactly. So meticulous manure management is critical. Things like minimizing any chance of feed or water contamination using raised troughs helps. Not spreading fresh manure on pastures. Cows will graze soon, maybe wait 30 days. Using separate equipment for handling manure versus handling feed. Simple things, but vital.
Hygiene and separation, basically. What about inside the barn itself, the housing environment?
It plays a massive role. We know close contact drives transmission. So keeping sheds clean is basic. Improving ventilation is important, and crucially, reducing stocking densities. Fewer cows packed together means less chance for the virus to build up and spread.
Makes sense. Less crowding, less virus load.
Right. And simple things like locating calf housing away from older animals helps protect those really vulnerable younglings, even though WD mainly hits adults. Finally, think about stress.
How does stress play into it?
Anything that stresses the herd overcrowding, sudden big diet changes, heat stress, even poorly managed metabolic diseases like milk fever or ketosis can lower their overall immunity, making them more susceptible to getting sick if BCOV comes along. So minimizing stress boosts resilience.
So biosecurity, manure management, good housing, low stress. What about vaccines? Is there a shot for this?
That's the kicker. Currently, there is no specific vaccine available in the United States licensed for preventing winter dysentery in adult cows.
Really? No vaccine?
Not specifically for adult WD prevention. There are BCOV vaccines, but they're primarily targeted for preventing scours, diarrhea in calves. Whether they offer any significant protection against the adult form of the disease, well, that's largely unknown or considered unlikely to be sufficient.
So vaccination isn't really an option for prevention in the milking herd right now?
Not a reliable one, no. Interestingly, natural infection does seem to provide some immunity, maybe lasting 1 to 5 years. But that lack of a dedicated adult vaccine just hammers home how incredibly important all those other things are. The biosecurity, the management, the environmental control, those are your main tools.
Okay, so let's recap this deep dive then. Winter dysentery. It's highly contagious, caused mainly by bovine coronavirus, hits adult dairy cows in winter housing.
Right. Characterized by that sudden severe diarrhea and, critically, that profound drop in milk production, which causes major economic loss.
But importantly, usually very low direct mortality. Most cows survive the illness itself.
Correct. And managing it effectively means, well, an integrated approach. You need rapid recognition based on those clinical signs and herd patterns.
Followed by robust supportive care fluids, electrolytes, nutrition, careful use of NSAIDs, avoiding unnecessary antibiotics.
And underpinned by stringent, practical biosecurity and management strategies to prevent it from getting established or recurring in the first place. It's really a whole farm approach.
A complex puzzle needing all the pieces in place to protect the herd and ultimately the farm's livelihood.
Exactly. And, despite everything we do know and the effective management strategies we have, it still raises an important question. Where do we go from here?
What do you mean?
Well, the economic burden of winter dysentery is still really significant globally. There are definitely critical areas needing more research and development.
Such as?
We urgently need better diagnostics. Faster, more sensitive tests to overcome those limitations we talked about. Getting a reliable answer quickly would make a huge difference.
Faster diagnostics. Okay. What else?
Exploring more of those novel supportive therapies, things that really target gut health, the microbiome, maybe help restore function faster after the viral damage. That could be revolutionary for management.
And the big one, vaccines.
That's probably the holy grail. Investigating vaccine strategies that are actually effective and provide long-lasting protection specifically for adult cattle against winter dysentery. Given the current lack of one, that's a huge area for research.
So better tests, new gut therapies, and an effective adult vaccine.
Yeah, and think about understanding the virus itself better, too. Are there different strains of B. hive causing WD? How does host immunity really work, and why does it sometimes fail? Answering those questions could unlock completely new ways to prevent and control this. Imagine the impact that could have, not just for individual cows, but for the sustainability and profitability of dairy farms everywhere.